Steph Smith was just 19 years old when she started working at the Huntercombe Hospital, Maidenhead. As a former patient of the hospital, she really hoped she could make a difference to the patients there. She joined the hospital in November 2021.
I spent most of my days clocking in, going to handover and going straight into a restraint and being there for hours. We had patients who were physically restrained, and so it would sometimes be for nasogastric feeds. We'd have people who were fed through a tube and they would be dragged to the treatment room and then restrained by several members of staff so that they could be force-fed. To be seeing the young people just deteriorating in each and every shift, it was really, really devastating. The longer they were there, the harder it became for them to come home and to be moved to somewhere more appropriate, which meant they were kept there longer. It was a horrible, vicious cycle. And it was really hard to see. I cared so much about these young people, and it just breaks my heart to know how much trauma they went through every day. They were just being traumatised over and over again. And it feels awful to have been complicit in that.
On the 12th of February 2022, Ruth Shemankovich was left alone by an inexperienced care worker. He'd had just a day and a half's training before his first shift at the hospital. The worker, known as Ibo Achimpong, was working under a fake ID and left Ruth alone despite her needing constant observation.
Ruth was so lovely. She was really funny and really kind. There were quite a few young people on the unit who used to get on really well, and they all adored Ruth, as did she. They were also thoughtful, and she was just a really lovely person. She loved animals and the outdoors, and we used to play sort of games and puzzles together when I was on her one-to-one, which was really special. She was someone who had such a bright future ahead of her.
Ruth was left alone for over 15 minutes. During this time, she made her way to her room, closed the door, and fatally self-harmed. She died in hospital 2 days later.
I was really shocked and devastated to hear of Ruth's death, but there had been so many warning signs for so many years. We had had countless near misses, even in the time that I'd worked there, and I think back to when I was a patient, there were so many signs, there were so many times when something could have happened and nearly happened, and it was only by pure chance that it didn't end in such a tragedy. And sadly, it was only a matter of time before something like that would happen. And it breaks my heart that it took an innocent and vulnerable 14-year-old girl dying for the hospital to close down. It should have been closed down years ago. There should have been real change decades ago when all these other people had been through so many similar situations. It was only a matter of time, and that's the saddest thing. It should never have happened, but unfortunately, with the way that the hospital was run, there was always going to be a tragedy like that.
We approached Active Care Group for comment. It said when it took over the hospital, significant investments were made into recruitment and staff training, adding there were years of well-documented mismanagement by previous owners.